Hey guys, John Schoen from Schoen Safety and Training here, sitting in the office because I feel like it's a lot more quiet and calm and I can get things done. Today's lesson is about burns. So, 3 types of burns: superficial, partial thickness, full thickness. We used to call them first, second, and third degree burns, but now we call them the descriptive words superficial, partial thickness, full thickness. Today we're going to talk about care steps, signs and symptoms, and when it's serious. Superficial burns, that's where your skin turns red and it hurts. Think, I pulled a cup of hot water out of the microwave, I stuck my finger in it, I got a little red mark. That would be a superficial burn. Run it under cool running water or a cold wet cloth for 10 minutes, at least 10 minutes. Now, here is where a couple of the sources disagree. Some people say you should put something on it to moisturize it, but most people don't. My suggestion is, if you are not going to the doctor, wait till the next day. Wait 24 hours before you start putting things on to moisturize it, and try to avoid petroleum-based products. Vitamin E or a non-petroleum-based cream. So that's a superficial burn. Partial thickness burn, involving multiple layers of skin. This is where we talk about some blistering. Blistering has happened. How bad is it? Are the blisters covering an area bigger than the size of a nickel? So back in my first aid days, they talked about the rule of 5, where if it's bigger than the palm of the victim's hand and there's blistering, it's considered life-threatening. Now, I myself have seen some burns like that. And as a child, I had some pretty bad sunburns with blisters all over my back because I have very, very pale skin. So, partial thickness burns. Cool it for 10 minutes, at least 10 minutes, with cool running water. Cool running water. Cold cloth if you don't have cool running water, cold towels. If it's serious enough, those blisters are covering more than the palm of the victim's hand, you're going to want to cover it with a clean, sterile dressing. If you are, and seek medical attention, whether that's a doctor, an urgent care, or the emergency room. Now, serious burns. Full thickness, involving all of the layers of the skin. Usually when you see a full thickness burn, this means that the skin is open somewhere. There may be bleeding, there may be charring. You can see that it is multiple layers of the skin. That is a definite. Call 911 as quickly as you can. If the person's experienced serious pain, which they may not from a serious burn, they may have, the nerve endings may be completely damaged and they don't feel anything, you want to cool for 10 minutes under cool running water, and then wrap with a clean, sterile dressing. Loosely wrap with a clean, sterile dressing. If you don't have a sterile dressing available to you, you can use cling wrap or saran wrap from your kitchen. That will help seal in the wound until it can get proper care. So those are kind of some basic burn descriptions and stuff. Hopefully that helps you. If you have any questions, pop them in the comments section. Please follow our YouTube channel and feel free to ask questions, and I'll do my best to research them and give you a good answer. This is John Schoen from Schoen Safety and Training talking about burns.